go ahead and get started. First of all, I want to thank everybody for being here. I want to thank TSU and OFA, Organizing for America, for organizing this event. Really important discussion about healthcare. I'm sure you've all heard so much about it. Anyway, Professor Christina Sanders is going to give a little introduction about what we're going to be doing today.
Actually, I just want to first of all thank each of you guys for coming out tonight, and I just want to welcome you guys to Texas Southern University School of Public Affairs, where we hope to educate, enlighten, and empower our young people about their society and about things that are going on around them that affect them. So keep your eyes and your ears open. You have some great people that are here tonight. Thanks to Organizing for America and all of the great panelists that are available to you guys tonight. So listen, learn, and if you have questions, it'll be open at the end. Thank you.
Okay, my name's Joe Desseltel. I've done some work with OFA in the past. I've done work for the Democratic Party. I've worked in the Texas legislature. Just give you a little background on myself while I'm standing here. Maybe Amber and OFA, she's around here somewhere. Oh, there she is, right there. She invited me to come speak, and I really appreciate that. And especially with the distinguished panel that we have here today. Very well-informed individuals that are going to give you some insight about why this issue is so important and why everybody needs to take part in this discussion. Because this is a two-way street. It's not about just listening to what you hear on the radio. We're actually going to be talking about the president's plan. That is Obama's health care plan. Not to be confused with Obamacare or anything else that you might have heard about. You may have picked up some of these sheets. It pretty much lays out the plan. And we'll be discussing that a little bit later. So I'm going to go ahead and start this out with introducing our first panelist. Her name is Elena Marks. She is the Director of Health and Environmental Policy for Mayor White. And I assume maybe candidate White, is that correct? Okay. Today we're talking, it's Mayor White. She also coordinates all matters relating to public health, healthcare, and environment on behalf of Mayor White. So without further ado,
Thank you, and thank you for letting me go first, being with these panelists that you're going to have really good information, and I get the easy job because I get to start and then everybody else gets to sort of fill in. If you had any doubt about whether healthcare reform was needed, and you lived in Houston, Texas, we would probably institutionalize you immediately, because if you live here, you see every day why we need healthcare reform. This country has the most expensive healthcare delivery system in the world, and it produces pretty much the worst outcomes of any industrialized country, and it's absolutely unacceptable. Projections show that if we don't do something serious and drastic, things are going to get worse, not better, and this is an opportunity that we all have to make some significant change. If you live here in Houston and Harris County, you're living in one of the areas of the country that has the highest rate of people without insurance. If you don't have insurance, you don't have access to care except through hospital emergencies, and if you're really lucky, through the Harris County Hospital District. The hospital district is not funded to provide all the care for the people who need health care in this community and don't have insurance, and yet we're depending on them to do an impossible job. And so what happens is people end up sicker than they ought to be, not getting preventive care, and once they finally do get care, it's more expensive, and because of the system that we have, it's extremely fragmented. This is an opportunity to change all that, to make sure that we improve the quality of the care we get, we can drive down the costs of the care we get, at the same time we can improve the access to care that we get so that everybody has the opportunity to get quality health care at an affordable cost. And we can only do that if we, this is not on? It is on.
Yeah.
All right, now it's on. But we can only do that if we do something drastic in this country. And we have that opportunity, but it's only going to happen if we allow our elected officials to know how we feel about this. And so I hope as you listen to the speakers tonight, You will hear some compelling arguments for making radical and bold changes. All of you in the audience probably have your own stories to tell, and it's going to happen at the national level. What we've been able to do locally in Houston is a great step forward, but it's only a step forward that a city can make, and it doesn't compare to what can happen on a national level. Within the city of Houston, we've increased access to health care by putting primary care providers in all 7 of the city clinics, and that's a drop in the bucket. Out of those 7 new facilities, we'll probably see maybe 100,000 more patient visits a year, and that's in a city where the uninsured population is more than 1 million people. We are also about to roll out a 3-share health insurance program, and that's a form of a public option. Nobody wants to talk about public option today, apparently, in Washington. But we do have a public option that is about to roll out in Houston and Harris County, and it's an insurance program through which small employers can finally afford to provide insurance to their employees, because there will be a subsidy fund that will be cobbled together through local and state and philanthropic dollars, so that those dollars can be matched 2 to 1 with dollars from employees and dollars from employers to provide health insurance for people who haven't had insurance in at least a year. And that's a small step. Imagine if we had something like that happening on a national level, where we used a little bit of a public subsidy and leveraged that with the dollars of employers and of individuals. And we have the opportunity to do that at the national level if we let our lawmakers know we want to do something like that. We also, in the city of Houston, have a pay-or-play program for our contractors, whereby our contractors are required to either demonstrate that they're providing health benefits to their employees, or they have to pay into a fund which we use to subsidize the cost of uninsured care. When you hear it discussed at the national level, it's called a mandate. We are requiring that people account for health care expenditures, because they don't go away. If an employer is not providing health insurance to their employees, the costs of those employees' health care doesn't just disappear, it's simply transferred on to other people. And the city of Houston is recognizing that by making sure that our contractors are accountable. They are either going to provide benefits to their employees, or they're paying into a fund that we collect. And we've raised nearly $1 million in that fund, and we've turned it right back around and putting it into the 3-share program and into our nonprofit community providers. Those are really small steps, but it's what we've been able to do at the local level. Imagine taking both of those concepts and running them out across the entire country, the power that that would bring, the dollars that that would bring by leveraging multiple sources to bring people into the system who have never been there before, and to increase their access to care at an appropriate cost and an appropriate level of care, so that we could all move forward with some bold action. I'm glad you're all here tonight. I hope this is a sign that you're going to let your elected officials in Washington know that you want something big and important to happen, because we cannot continue paying more than anybody in the world to get less than pretty much anybody in the world, absent countries that we don't really like to compare ourselves with. So listen to these great panelists and let your elected officials know what you believe, because they're the ones who can make a difference. And who you vote for and what you tell them really does matter. Thank you.
Well, I want to go ahead and introduce the rest of the panel.
Sir, we
I
can't hear you.
apologize. Okay, I'm going to have to slouch in a little bit, because
Okay.
apparently I'm a little too tall for this microphone. Okay, we have Dr. Melanie Wilson Lawson, PhD, Assistant Professor of Healthcare Administration at Texas Southern University School of Pharmacy and Health Sciences. We also have Dr. Saeed Ahmed, MD, specializing in internal medicine in the Katy area. Annie Banks, President of the Alliance of Retired Americans, and sits on the board of the Houston Federation of Teachers. We have Travis Shive, I'm sorry, we went over this. He's the president of the Harris County Young Democrats in the University of Houston Downtown Studio.